Think a biopsy will make cancer spread? That's like thinking cutting a cake makes more cake. A biopsy is done because your doctor suspects cancer. And the most common types are 1. Fine needle aspiration, commonly referred to as FNA. This uses the smallest needle to collect sample cells from a suspicious mass. It's commonly used for solid cancers such as breast, thyroid, head, and neck cancers. This FNA procedure has a low probability of bleeding complications given the small bore, 22-25 gauge, needle lumen. Note, it's not recommended for lymphoma diagnosis or verification. 2. Core needle biopsy. This uses a larger bore, 14-20 gauge needle, and is commonly used for lymphomas and solitary myelomas. The larger bore is needed for blood cancers like lymphomas because diagnosis depends heavily on the morphology of lymphoma distribution. 3. Excisional biopsy. This is a surgical biopsy where an incision is made with a knife to remove the entire lymph node or a piece of cancer during surgery. This method gives pathologists an unhindered view of the entire cancer neighborhood to make the most accurate diagnosis. And here's the truth bomb. A biopsy is the gold standard for diagnosis. Nothing more accurate exists. Will it make cancer spread? The chance is about the same as winning the lottery. The procedure has a very low probability of spreading cancer when performed by a qualified physician. There is only a theoretical risk that cancer cells may be dislodged during the biopsy or dropped while withdrawing the needle. In blood cancers, such as lymphomas, this is not an issue because lymphomas are liquid cancers. What happens if you skip it? Without a biopsy, you won't know how to solve the problem because you don't even know what you're dealing with. Yes, it might sting a little, but hey, better a quick pinch than a long hospital stay, right? So, get that biopsy. We've got more cancer fighting tips coming your way. So hit that subscribe button before your finger gets tired.